To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about new stem cell therapies, and of course I'm joined by Dr. Delo from Delo Sports Medicine. Hey doctor.
Hello.
Well, who else would we have on if we're going to talk about groundbreaking things in stem cells? So we talked before, the normal way, or the way we talked about before, was stem cells to treat the body from the bone marrow. Now there are things that are new and different.
Yeah, so bone marrow historically had the most evidence for it, and we've been using it for treating, mostly in my world, orthopedic injuries. But yeah, recently there have been new preparation techniques and kits approved by the FDA to use adipose tissue, which is fat. I think everyone knows that fat regenerates, so it has a huge number of stem cells, actually a higher percentage of stem cells than the bone marrow has. And now we're able to prepare it better than we used to be for injection into joints and tendons and other structures.
Who would have thought that your fat could help you? But in this case, it might a little bit. Okay, so who would benefit from doing this versus the marrow?
Well, for some of my patients, it is just a personal preference. They don't like the idea of me going through their bone to get at the marrow. Fat is very accessible. It's just in that subcutaneous space. Most people have enough for us. We don't need a huge volume to use for joint treatments. But some situations, it does look like fat may be better. Some of the functional outcome studies in knee arthritis and shoulder arthritis are looking really hopeful for fat, which can work to improve the actual structure of the joint a little bit. Also in things where we need more of a graft. So the fat will stay as fat for a period of time. So if we have a meniscal tear or a labral tear or a tendon tear that we want something to go into that tear and sit there and release stem cells, then the fat is looking advantageous for that.
And maybe this is a good reminder of why we should start thinking about when it's time for the stem cell therapy versus not. When would I know this is for me?
Well, one of the deciding factors is age. You know, I love PRP treatment, but the trends really do show that it works best in the younger population, middle age. If it's mild to moderate disease or a small or partial tear, still could be really effective. As we get into more severe disease and in an older population, sometimes we need stem cells. So then we can have that discussion based on your injury pattern. Does this look like it would respond better to bone marrow versus adipose? And sometimes, depending on patients' medical histories also, we may lean one way or the other.
Well, doctor, thanks for giving us all the good information on stem cells. So thank you for being here, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.